if you run a medical practice, a dental office, or any healthcare business. HIPAA compliance is not optional, and yet 75% of the practices I walk into have serious compliance gaps they do not even know about. I am Foster Scotland, and today we are covering HIPAA compliance from the ground up. No jargon, no scare tactics, just what you need to know and what you need to do. Welcome to the Onyx IT Group. I have spent decades helping healthcare practices achieve and maintain HIPAA compliance. And I can tell you, most compliance issues are not from a lack of caring. They are from a lack of understanding what HIPAA actually requires. So let us break it down into plain English. HIPAA, the Health Insurance Portability and Accountability Act, has two main rules you need to know about. The privacy rule covers how protected health information, or PHI, can be used and disclosed. This is about policy. Who can see patient information, when they can see it, and what they can do with it. If your front desk staff can pull up any patient file at any time for any reason, that is a privacy rule issue. The security rule covers how electronic PHI is protected. This is about technology and process, access controls, encryption, audit logs, backup, network security. This is where most practices fail because the security rule requires specific technical safeguards that many practices simply have not implemented. And then there's the breach notification rule. If PHI is exposed, whether through a hack, a lost laptop, or a misdirected email, you have 60 days to notify affected patients. And if the breach affects 500 or more individuals, you must notify HHS and potentially the media. Understanding which rule applies to which situation is the first step. But here's the key. Compliance is not a checklist you complete once. It is an ongoing program that requires regular review. Let us get into the technical safeguards the security rule requires. These are the things your IT team or MSP should be handling. First, access controls. Every user needs a unique ID, no shared logins. Access must be role-based. A billing specialist does not need the same access as a physician, and you must have automatic log-off. If a workstation is left unattended for 15 minutes, it should lock. Second, audit controls. You must be able to track who accessed what PHI and when. If there is a breach, you need to be able to reconstruct the timeline. This means audit logging on your EHR system, your network, and your email. Third, integrity controls. You need to ensure PHI has not been altered or destroyed inappropriately. This ties into your backup strategy. If someone modifies or deletes records, you need to be able to recover the original. Fourth, transmission security. When PHI leaves your network, to a lab, to a specialist, to a patient portal, it must be encrypted in transit. No exceptions. And at rest, on your servers and workstations. Encryption is strongly recommended and in some cases required. Fifth, device and media controls. If a laptop with PHI is lost or stolen and the hard drive is not encrypted, that is a reportable breach. Full disk encryption on every device that could potentially access PHI is non-negotiable. Here's the thing that trips up most practices. The HIPAA Security Risk Assessment. This is not optional. It is required by the security rule, and HHS considers it the foundation of compliance. A risk assessment looks at every place PHI is created, received, maintained, or transmitted. It identifies threats to that data, evaluates the likelihood of those threats, and determines what safeguards you have in place. The gap between what you have and what you need becomes your remediation plan. This assessment must be documented, not in your head, not in a checklist, in a formal document that you can produce if HHS comes knocking. And it must be reviewed and updated annually or whenever you have a significant change. New EHR system, new office location, new staff roles. If you have never done a formal risk assessment, or if your last one is more than a year old, you are out of compliance. Full stop. This is the single most common finding in HIPAA audits. Let me share the most common HIPAA compliance gaps I find when I assess a practice. Number 1, unencrypted devices, laptops, USB drives, even phones that can access PHI. If these are not encrypted, you are one lost laptop away from a reportable breach. Number 2, shared logins. When 3 people use the same login, your audit trail is useless. You cannot prove who did what. Number 3, no business associate agreements. Every vendor that touches your PHI, your EHR vendor, your IT provider, your shredding company, needs a signed BAA. No BAA, no compliance. Number 4, outdated risk assessments. A risk assessment from 2019 does not reflect your current environment. If you have added cloud services, remote work, or new devices since then, your assessment is stale. Number 5, no breach response plan. When something goes wrong, your staff needs to know exactly what to do, who to call, how to contain it, how to document it. HIPAA compliance can feel overwhelming, but it does not have to be. If you want a HIPAA compliance checklist that walks through every requirement we discussed today, join us at CyberShield AI Academy. Link in the description. We have templates for risk assessments, breach response plans, and business associate agreements. Foster Scotland, the Onyx IT Group. Protect your patients, protect your practice.